I like to use a really simple clinical reasoning framework. So when I've heard their story, the things that go through my head are, is it torn? So have they got a history of trauma that is significant enough that it might have caused structural damage? So the young cuff tear or the young instability, that might be relevant, but they may have an AC joint instability too. And again, all those things we've just talked about, am I going to think about some imaging, and is it going to reduce my ability to help them? If it's not torn, the next question I ask myself is, have they got a history consistent with a stiff shoulder? Now, of course, there's lots of different causes of stiff shoulders. If it's arthritic, I'm not going to be able to change that stiffness. If it's capsular, are there a frozen shoulder, a post-op, a post-trauma? Or again, is there other things that might contribute to stiffness? Now, again, the reason that's relevant, if we look at the limited evidence that we have, generally I need about 70% of my rotational range in any direction for my muscle system to be able to do its job through the full range of elevation. So if they have got stiffness and it's not arthritic, so again, if it's bony stiffness, I can't change it. But if it's capsular or muscle stiffness, I can change it. So I might have to target that before I can look at targeting the muscle system. If it's not stiff, the next question I ask myself is it irritable? And by that, I just mean acute causes of shoulder pain. So a reactive tendinopathy, a calcific tendinitis, a developing frozen shoulder. And the only reason that's relevant is if they have very irritable acute shoulder pain, I might not be able to change it with my symptom modification. Because having asked myself those three questions, is it torn, is it stiff, is it irritable, then obviously I do my usual objective in terms of look, move, feel, and resist. But I'm also going to use symptom modification. So my next question is, can I change it? And so I use some very simple principles to look at, can I change their movement that's most painful? And my final question is it strong enough to do the thing that they want to do?